Francis with us to our group. I think all of you know Kate has stepped away from Open. So Francis will be joining us from now on, taking over Kate's responsibilities with our meetings, taking notes for us, and be part of our meeting every month. So welcome, Francis. And do you know everyone? I think you know everyone.
I think I know everybody for the most part. I don't know that I have placed faces with names for everybody.
Okay, let's go ahead and introduce ourselves. Go around then. I know that the screens are different, so I'll just call your name. You could just tell you who you are, what you're with. Okay, Lindsay.
Good afternoon. I'm Lindsay Deinhammer. I work with Children's Health Alliance and the Wisconsin Oral Health Coalition.
Marla.
Marla Morse, Oral Health Ohio.
Deb.
Your favorite pain in the rear, Francis. Deb Jacoby from Minnesota.
Jenna.
Hello, everyone. Jenna Linden. I'm the program leader for oral health team at the Children's Health Alliance with Lindsay in Wisconsin.
Anne.
Hi, I'm Ann Tusher. I'm with Chicago Department of Public Health. I'm the program director of the Oral Health Division.
Alicia.
I am Alicia Gonzalez. I am the project coordinator for the Oral Health Forum in Illinois.
Ashley.
Ashley Herman, Missouri Coalition for Oral Health.
And Clarence.
Good afternoon, everybody. Clarence Jones. I'm with the Human Partnership and with Minnesota. And thank you, Deb. Okay.
I don't know who that last one is. Read AI meeting.
I think that's a bot that will send the summary following.
All right. And then Tanya and Kim, you know both of us. So welcome to our meetings, Francis.
Thank you all so much. It's good to see you all.
Yeah. All right, Tanya, want to start right into our discussion today?
Well, there's somebody who didn't get introduced, Ashley.
Oh.
You should know Branch by now. It's about nap time here, so don't mind the surroundings. We're upstairs trying to get him to actually take his nap. So
Hi, Branch.
He's watching us so intently.
I don't think I've seen him yet, but congrats. He's adorable.
Thanks. He'll be 2 in September.
Gosh, he's growing up. Goodness, he's been on as a baby, but I think this is the first time we've seen you as a toddler in a long time. Time for nap time. Oh my goodness. So we thanks everybody for joining. As we kind of thought about what we were going to talk about today, the more we thought about it, we thought let's see if we can seize on some of the momentum of the ROHCT team meeting last month, because there was so much energy around the topic of workforce, and we had, if you recall, those breakout rooms. And we got to thinking, like, what if we would, we really kind of never got to do a so what after that. We never got to do a debrief. We never got to do a what did we all learn as a team. And the so what could possibly be, are there some things we as the Midwest team could do to support each other, could share some things that are kind of uniquely Midwestern? Are there any projects we could work on? So I'm not coming with any proposals or anything, but just thinking that there's probably just a lot of momentum that we could seize on, especially because we all have, kind of a common experience of, I think other areas certainly have rural issues to deal with. We really have rural issues to deal with in our region. That kind of defines Midwest. So that might be what we want to talk about. But yeah, we were just kind of hoping to do a little bit of a debrief and kind of a share maybe what you heard, what you learned, and start to kind of have some resource sharing among ourselves. We did talk about having this meeting to be discussing how to basically communicate with conservative policymakers, and we ended up deciding let's move that till August, because that way it'll be much closer to when we do Hill Day, because Hill Day, of course, is September 12th and 13th. So if we have the policy making kind of question or conversation in August, it'll get us a lot closer to that and make even more sense maybe. So that's what we were hoping to do today, is just spend our whole time honestly just like sharing, debriefing, brainstorming. Does that sound okay to everybody? Cool. Seems like we always enjoy just sharing with each other more than anything. And sometimes we get very excited about it. So I guess I wonder, and maybe we can just kind of start out with, does anybody have any reflections on, you know, have you been thinking about that last meeting and been reflecting like, gosh, I learned this and didn't know that before? Any you know, reflections you want to start out with, and then we can dig into some more specific things. Good job of avoiding eye contact, everybody.
Can we have a little bit of a maybe a debrief of what the meeting was? I think I was on it too, but I feel like a lot has happened. And just kind of recap so that we can jump back in.
Thank you. Thank you, Lindsay. Actually, that's exactly the right
Would
place
help
to-
me.
Yeah, absolutely. So what we and actually now I have forgotten a little bit of it myself, but we broke into we spent, I think it was just an hour. We broke into 4 breakout rooms around 4 different topics, and so I'll share what those were. And I think we were going to try to rotate around to maybe 3 or 4 each, but I think we just did 2.
I remember. Okay, it's coming back to me now. See, that helped even.
So one of the topics was racial and ethnic disparities in the workforce. Scrolling here, another one was addressing the life challenges of new dentists regarding things like housing, childcare, feeling connected to small or rural communities. And if you might recall, it just maybe like an hour ago, I emailed you all some of the notes specifically from that breakout because it was related to the rural communities. Also, whoever facilitated that one did the best job of outlining issues and then coming up with suggested next steps. I say that especially because I was one of the facilitators and I did not do a good job compared to that person. So bravo. And then we talked about another group was community health workers and promotores as part of the dental workforce. And the last one was essentially kind of the workforce pipeline, helping elementary and middle and high school students see a future in the dental professions. So those were the 4 topics. I don't think we ended up being able to self-select. So I think whoever, we all each kind of got selected into those topics. So part of the memory maybe too, maybe that I was in a group that wasn't my passion issue. I don't know. Or maybe it was, my gosh, I got put in the group that really did make the most sense to me. Does that help, Lindsay?
Does help. And I cannot completely recall what we talked about, but I know that Jen and I have our next meeting of the day, or at least my next one. She might have one in between too. Is we're working with AHAC to do workforce in the high schools in Wisconsin. They're going to be doing around the state. They will do workforce days. We're being asked to help with the Milwaukee one, but there's Jen, I don't even know how many regions. Is it 6 or 7 that we'll be doing?
Good 7.
Yeah. So they'll have one day where high school students can come and learn about oral health workforce. So I've been at one meeting with the Milwaukee group. We're meeting again. We will have a day. So they'll have a day where they'll come to one of the technical schools to learn about. And my understanding is that that group, there'll be like 50 students that will be invited to come and learn more about all different levels of different oral health careers that they can look at. So I think Jen and I's role will be to help get some speakers or facilitate some professional connections for the group.
That sounds really cool. It's AHEC. Is that? I know
you're great, Jenna. Do you have I'll put you on the spot too, but
I
let
think
me see if I
it's area health, education. Let me look it up. I'll tell you for sure.
It's
might
the
have
area
to-
health
You're right,
education
Area Health
centers.
Education
Yeah.
Center.
Yeah. Okay.
And I think Minnesota used to have one and doesn't anymore, which is sad to me. Is that true that not every state has them anymore?
I don't know.
Yeah. I know Minnesota did have one, but it's no longer there.
Okay.
I'm kind of jealous of the other states though. I thought it was a great program.
I
So-
agree.
I think it's great for workforce, but great for the students too. I look at it both ways for them to be able to experience and get information.
So did you all bring that up to AHEC, Lindsay, or did they come to you and say, we'd like to do this? Would you help us? Like,
Jenna and I've had conversations with them already, and you can jump in, Jenna. We had been speaking with them about workforce issues, and then they did come to us when the funding came to them for doing the workforce day.
Yeah, I think it
to
was
see-
initiated through actually the Department of Health Services Oral Health Program, and their HRSA funding was, for the next couple of years is all around workforce. So it was part of that initiative. And so we just kind of merged our initiatives to be able to help with
Yeah.
that.
Did you develop a curriculum for that particular, like the high schools, or if you do grade schools, I'm not sure.
Doing high schools, and as of right now, like I said, we've met once, and from what I can see they're doing is we met with partners from one of the technical schools in Milwaukee, and so they had people come to the table for dental hygiene, dental assisting. We have Marquette Dental School. Well, they were not at the last meeting, but we're going to work to get somebody from the dental school to be part of it. And then there is another career, and I apologize, I don't know, it's doing the tools with dental. I don't know the name of actual degree that you get. You know, Jenna, what the,
Like a lab tech or a dental,
the
or something
lab,
like that.
yes.
Yeah.
So they'll have the opportunity. So their goal was to bring in professionals from each one of those areas that are practicing, and then also from the dental school, and then students from each of them. Like, so they'll have high school students, but then students in the program, so that the high school students can speak with both the professionals. So it'll be a one-day, I think, activity where they'll come in and get to learn about that. So we won't be doing the curriculum portion of it. I think it's going to be more informational for them.
That's really cool. I wonder if our research thing now is those of us who don't know if we have one should kind of reach out and figure out if there are AHECs in our states.
The last thing I see posted is like 2011 in Minnesota. So I'm guessing that means defunct. Or well hidden.
So the technical schools is just helping me get oriented. Would those be schools that do both dental assisting programs and dental hygiene programs, or? Okay. That's very exciting. I'll be eager to hear how it goes, and like how the students react, and if there's good turnout. So do kids get to self-select, like, hey, I'm totally interested in going and learning about this, or?
I think they have to be. So there is somebody from AHEC, Milwaukee AHEC, that is helping coordinate with the high schools. And so they will, I think the students have to be part of AHEC to come and already participating in activities, because I think they're gonna have about 50 students that are able to come. And there were, I think, 2 or 3 high schools that they're going to draw from for that. So yeah.
I think there'll be more info on like DHS Oral Health, like their workforce portion of their website. So I was just browsing on it now, trying to find like the specifics about that event, which they hope to then do annually, like as an ongoing event every year. But there's also some really great like career exploration one-pagers for like dental assistant, dental dentist, dental lab tech, dental hygienist, which could be, I think will be really useful. I hadn't even seen them yet. It must be a newer resource they added. So I'll pop the link in the chat in case you want to kind of explore around that website at all.
That's a great idea.
That's a great idea.
And I know they're working, because the conversations that we gave them some dates that we were unavailable in October, but for the most part, they're trying to schedule the date around when there are students at the technical school, so that the high school students can actually see some of the activities of what's going on with the students too, where they have clinic day or something like that, so they can actually see some things too.
That's very cool. It makes me think, one of the idea we've had for a while, well, we've done a few like trainings at some high schools through, it's called JAG, Jobs for America's Graduates. Like, has anybody else have one of these organizations? I'm rather unclear about what they are, but there's some kind of a group that helps get students ready to graduate, career ready. And they've reached out to us, I think, and asked us to do a couple of different trainings for high school kids about dental careers. But it was really just like us at Oral Health Kansas, just putting together kind of a 30-minute quick curriculum and doing some overview for students. But it was like at the high school, like take one of us to the high school and then go from classroom to classroom doing this little thing, which I thought was kind of interesting. But this sounds like even cooler. But nobody else has a job, you even heard of that, Jobs for America's Graduates, JAG?
So
Mhm.
I was typing in the chat
Hmm.
because I don't want to pull there's career and career equity, which is something Apple Tree's working on. And then there's getting people out into rural areas. So give me some boundaries for the playpen here, Tanya, so that I can. Should I
I mean,
share
I
about
think
the career equity project or should I not?
I go for it. I think we could kind of take this whatever direction we want, wherever the energy is. So,
Well, even if it's just to look at for another time, if you're interested in this, because Apple Tree has, and I'll tell you the story that we've told funders and others that probably some of you may have been there. Could have been 10 years ago. Beth Mertz from UCSF said that if every dental seat in every dental school in the US went to an underrepresented person from an underrepresented community, it was going to take 10 or 15 years to have racial concordance between providers and populations. And it was sort of stunningly terrible. So we started that just, that little burr under the saddle or whatever. And so we started this. And it is for all of Minnesota, though. Our main champion started it in the Twin Cities, but I know that we are working with greater Minnesota schools too, to get kids interested in high school, before they're starting to think about their career paths. And I think we've had a great experience with students that have had shadowing opportunities. Some of them, it made it really clear that they didn't want a career in dentistry, but hey, that's okay too, right? It wasn't a conversion thing. It was a exploration thing. And we do have, centers in rural Minnesota. So I would just probably be validating everybody's experience and the things that you sent out, Tanya, that it's not for everybody. There are some people that have a preference for that, and that's great. But we have had providers, young dentists. I can think of one right off the top of my head, a pediatric specialist who said, as a young single person, I'm worried about going out into the middle of nowhere and who will I meet and who will I interact with? So that just validates that. So it's kind of like winnowing through to find the people for whom a small community or whatever is a better deal.
Deb, I just want to follow up on something you said about how, and this doesn't have to do with oral health workforce, but when you said how some students, dentistry is not for them. Several years ago, I met with the person at the Ohio Department of Education who oversees all the career technical programs in the state. And we were talking and he said, Marla, he said exactly what you said, not all students are strong in science and are going to go to dentistry, but what you need to be doing is you need to be exposing these kids to manufacturing of dental equipment, because we're a huge manufacturing state in Ohio, right?
Mm-hmm.
So at that time, we went ahead and we met with one of the distributors and said, would you be interested in doing something in rural Ohio to get, students interested in dental and servicing dental equipment and distributing, because he said it's a huge problem down in the rural areas, and especially in the Appalachian areas. He's like, we get a call and we may not have a technician. And anyway, but that got derailed by COVID and it's never been picked up. And I unfortunately don't have the capacity to revisit it right now, but I just wanted to just follow up on your point about, not all students are going to be strong in science, but they could support the dental workforce in other ways and other careers.
That's a great point. And we do say a little bit about, we have care coordinators, you know, we have other roles within Apple Tree as well, that maybe if they don't want to put their hands in somebody's mouth, they might be interested in that aspect of it. It's a good point. And the manufacturing is a great idea, because my understanding is a lot of people needed for that. And maybe in a rural area, that is a very appealing thing to find those tracks.
That's very interesting, Marla. Yeah, it's definitely something I never considered. Wow. I want to keep going on this real bit, but I want to double check. Deb, did you say that if the research said if every open spot in dental schools in the country was filled by a person from an underrepresented community, it would still take 10 to 15 years before there's equity between essentially white people and non-white people?
And that was like at that point when she wrote it. And as we are becoming a more diverse nation, so then it probably would still have lagged behind a little bit. So, yeah, that's what that was exactly our reaction, like, wow. And now, okay, I have to be careful here, but now with the stuff going on with enrollment, what is that? What are the implications of that? You know, Supreme Court decision, and I don't sort of out of my full understanding, but it seems like just when we thought we were maybe going to make headway in those ways, and now I don't know how much of a wrench has been thrown in that. And let me go back. I see that there was an oops in the, I can get us to the right place for the link, sorry.
I mean, that's not even a political thing to say. I think that is something really valid. If I mean, a huge part of what we're all talking and trying to work on is how do we get a dental workforce that accurately represents the actual population? And if now there's no affirmative action, how do we get a dental workforce that reflects the population?
I don't think it's about the affirmative action.
Okay.
Yeah,
Thank you.
I think, I mean, let's get it, you know, real, but at least for me, this is my perspective, okay?
Yeah.
This is about finding qualified students and allowing them to be a part of the process. I mean, I still think that there are a lot of people, all of us are biased. I mean, and so the question is, this is a business decision. This is not necessarily anything other than that. And people that are in the driver's seat understand this is about business, you know what I mean? So my goal is to just give information to people, and those that are interested, regardless of who they look like or whatever they like, you know, then that's what I do. I think that's the only thing that we can do. I mean, because once they get, to the schools and, you know, there's other factors, but I think from our perspective, we should talk about making sure that people are competent and ready to enter the force. And that's how I look at it. So the other things are just stuff. But it's true, we still struggle. But I'm just saying, our job right now, especially in this new normal, we got to find the right people.
Mm-hmm. And Clarence, so you don't think that and I trust you, and I hope I'm not saying anything totally stupid or whatever, so I trust you'll tell me if I am, but if in the past, the kind of legacy thing of many of the people that got admitted were the sons and daughters of previous graduates of that dental school, and the elementary, middle, high school presentations on career day were from the existing pool, that's not an issue worth trying to muck around in?
I think the thing for me is this, is that we're trying to find people to fill these positions.
Mm-hmm.
And we need to figure out what's the best way to do that. You're always going to have bias, you know, that's just life. I mean, even in our families, we like some of our brothers and sisters better than other brothers and sisters. It's just the way it is. Okay. But I think from our perspective, one of the greatest things that we can do is to talk about how do we present information, accurate and appropriate information for people to make an informed decision about whether or not they want to be in school or not.
Mm-hmm.
And the reality is this, is that there's always going to be challenges, and we can, it just is, so, I mean, that makes that sound like, I'm not defeated at all. I'm just saying, it's, the color of America, let me tell you this. I know I said this before. The color of America is really not black and white. The color of America is green. It's about the money, baby. And if you forget that, then you're lost, because that's what it's about. It's about capitalism and about making that money. So people will find a way to make something happen to make that money.
You're here. We just had a long conversation in a staff meeting this morning about dental service organizations, and that's kind of where I was going. Yeah, it's green. Okay, that's powerful. Thank you. We were also starting to go then into the rural workforce and some of the specific challenges. So did anybody participate in the rural workforce breakout last month? I did not. Okay, well, then we all live rural workforce, so we can just dive in. I sent some, like I said, I sent the talking points that came out of that group. We could talk through those. We could just share some ideas we all have in our own states. Well, I'll start with that. So one thing that, one kind of cool thing that we have in Kansas is we call it the KIND program. I think it stands for Kansas in Need of Dentists. Is that right? I don't know. Kansas Initiative for New Dentists. That's it. Kansas Initiative for New Dentists, KIND. It's funded by Delta Dental of Kansas, and it's run by the Dental Association. And so we don't have a dental school in Kansas, but we use the University of Missouri Kansas City Dental School as our dental school. So it's essentially, I think that most of this program runs through UMKC, and students who are interested in practicing in Kansas and who are interested in a loan repayment program. So it's basically a privately funded loan repayment program. They have to commit to living in one of a very select hand select small group of small rural areas of the state for X number of years, and they have to be Medicaid providers. And if they do that, they get, I forget how much, like I think it's maybe $25,000 a year of their loan repaid for however long they stay there. And so it's been it's a really creative way of doing things. I think maybe there's only 4 or 5 students at a time, taking advantage and moving to those rural areas. But you all know, if you got, 4 or 5 new dentists in some extremely rural areas, that's pretty massive change. I'm not saying we've solved things. I'm not saying things are rosy and happy, but it's a creative approach that I'm kind of intrigued by. I think I've heard of one example only where somebody participated in KIND and then moved to an extremely rural community and actually did find somebody, got married and stayed. Most of the others, stay, do their thing, and then probably move back to Kansas City or something. So, a larger city. But that's kind of, it's a creative, different approach than some of the other kind of traditional ones. I just thought I'd share because it's kind of interesting. It's a huge financial commitment on behalf of the of Delta Dental, and then of course the Dental Association. They actually don't get, they've got a very small staff. They only have 5 staff at our Dental Association. It's just or maybe it's only 4. It's a very small organization, and they don't even get paid for doing this. They just have to run this and this kind of big program just on their own budget. So I kind of find that to be impressive too. So I'll just kind of wanted to share that because I think it's a clever, interesting way of doing things. So anybody else have something clever and interesting? Or a conundrum you just want to discuss with your friends?
I'll report on something in Ohio. I know that we had a student early this year who we did a environmental scan of all the community health worker training programs in Ohio. And our student reached out to all of them to encourage them and to, first of all, determine, are you including oral health in your curriculum, because there's no requirement. And for those, and she presented to all of them. Some of them were, she presented Smiles for Life for community health, for frontline workers and other resources that they could use. Anyway, all of the programs were just so grateful that we reached out and are just thirsty for information about oral health across the lifespan, which has been great. But so that's been good. And we also have our the Ohio, I want to say our Ohio ambassador for the 100 Million Mouths campaign, then followed up after us to get curriculum, because she's doing the medical dental integration. So there's so we're leveraging, resources and making sure that these programs are getting a lot of support. And we're trying to develop, one of the things that we heard from the programs is they want case studies. They want to know like examples of case studies of oral health with community health workers. So we had one of our hygienists put together something, but I'm trying to get a dentist to look at it as well. But anyway, because that's what they asked for, we'll deliver it at some point. But in the meantime, our budget, the governor just signed our budget at the end of June, well, at the beginning of July. And in the budget is a thing called the let me look it up here, Center for Community Health Worker Excellence. And it's a line item in the budget. It's $5 million every single year. And it's really interesting. And I'm going to get to the oral health part of this, but it establishes, I'm going to read this, an electronic platform that can be accessed statewide to connect community health workers to individuals and communities. It makes continuing education credits for free for community health workers who are certified by the Board of Nursing. It provides financial assistance to employers that host or offer training to community health workers. Anyway, they also have a board of directors. And so I was on a call the other day with somebody who oversees sort of the Ohio Community Health Worker Association. And she was talking about this and I said, oh, so can we talk about getting an oral health provider on the board? And it was like a call like this. And I think she was very taken aback that I asked that. But, I think a really important strategy is that we get oral health providers on boards, especially statewide boards. So she's like, well, we've already kind of designated, but we could look at expansion. I said, oh, yes, please make sure that an oral health provider is on your expansion list because, that's one thing. And then, so that was just something that was just sort of in alignment with what we were doing at Oral Health Ohio, that with this thing passed in the budget, which is great. And it would be a coup to get a hygienist or a dentist on that board. Because they don't think about it. Like you could see her response was like, oh, that never occurred to us, right? So the other thing that we're trying to do is the Ohio Rural Health Association had put out some information about they need more board members. And I gave some dentists, I'm like, go apply, be a board member. You got to get these oral health providers on these statewide boards. So anyway, that's all I have to say.
That's very cool. Yeah, wow. Is there an oral health curriculum for community health workers then? Probably not.
They're just doing piecemeal, whatever, a lot of them are working with their local dental hygiene school. We have 13 of them in Ohio. So, yeah. But, the smart that we're trying to get, we want it to be so that, I don't know how familiar you are with the Smiles for Life for frontline workers. It's not as polished as the regular Smiles for Life for non-oral health professionals. But I just wish there was some way to, I can't even get somebody from the nursing board to, we want to get CE credits for these folks, right? But I'm not making any headway. So it's really there's no set curriculum to answer your question, Tanya.
It looks like Deb's saying.
Yeah, just, excuse me, just that Minnesota has a rural health advisory committee, so everything rural health, discussing all the issues that you've raised for us, I'm sure. And it used to be that there was just a other health provider. And so that might be, you name it, chiropractor, I don't even, I don't want to misstate things, but other. And then we were able to advocate that there should be a slot dedicated for dental, and the Dental Association preferred that it say dentist rather than dental professional or dental provider. So that was still a win, and that went on for a few years. And now I believe we have a second slot on that. So I think that's a good thing, because what Marla said is bring in the voice so that whatever's being discussed, that oral health is part of that. Yeah.
Is that something else that every state has, a rural health advisory committee? I'm embarrassed to say, I don't know. Because boy, if there is, would that be like, what if we all just made that a goal? Like, let's get an oral health person on those, or on those committees.
I just wrote that down to make sure that I checked to see, and then to see if there's oral health on that
Yeah.
advisory board for Illinois.
Is anybody else working with them besides Minnesota? I want to believe there is something like that in most
Ours
states.
is a committee that advises the commissioner. So, it might be something like that, something to an agency, an advisory committee to an agency.
The commissioner of,
I believe it's health.
oh, okay, so like
We have health, we have MDH, and we have DHS, Department of Human Services, but I think that committee is advisory to health.
got it. In other states might call it a secretary of a agency, commissioner. Yeah, got it. That's fascinating. What else? Other thoughts, ideas? To me, that I'm starting to have some energy around figuring out if we have those and what that form might take in our states, and could we all maybe work together on an approach to try to get dental representation. Are there other things that you see like, oh, there's something we could all work on together? I don't know if we've covered enough issues to get there even. I'm looking back at the list of things I emailed you all a little while ago. And some of the, and maybe it's just something we all had to just reread once in a while, because some of the ideas about how do you get dentists to say, yes, I'd be happy to move to a rural community is, there's one about a lack of amenities. So develop initiatives to improve amenities, and extol the virtues of rural living. Work on programs to have job placement, programs for spouses. I've always said you need a dating service too. Somebody put, Allie, can I call out what you said in the private chat? She's suggesting maybe we, or do you want to say it out loud? We suggesting maybe we list all these issues and links from other states and what the organizations and efforts are. So maybe we can probably do that from the conversation here today. We can probably start to put together a little spreadsheet of here's some of the resources we're hearing about from our states, and kind of keep building on it. I had made note, so I only sent you guys that part of the notes. I can send the whole thing, but there are a couple of other bits I made note of that are from other states in our region, but the states aren't represented today. So for example, North Dakota, this is in the breakout around racial and ethnic disparities. North Dakota said rural access to care is, of course, the #1 problem. That's a very, very rural state. So they're working on mapping out the career academies in the state and trying to get them all to have a dental component, similar to what we talked about earlier. They're trying to actually get a dental assisting and a dental hygiene program established at Bismarck State University. And then they're looking at the Danby certification model, which is a certification for dental assistants. So they're trying to look at that model in career academies in the state. So I think that's all really interesting too. So Allie, I'm starting to like your idea. If we start to catalog this stuff, it may help us all think about what we can do. Sounds like there's just neat things happening in lots of different places, but how do we get them to cross-pollinate better?
Just to also piggyback on that, the Northeast Mid-Atlantic region, they also have a spreadsheet that has like all connections, communications, resources. So I would propose, I don't know if you guys want to share. I could recommend even just like, because I think there's a lot of this interest across all regions. So, you know, maybe it could be a national sheet. And stuff. So I think Sue Keller would probably say thumbs up massively, but
And she's in Massachusetts, I think, but I don't know what, I know, I'm confused.
oh, she developed the sheet based on like
Oh.
the initial conversation. So Nima's been updating it, but I think having more participation would be great. I'll find that.
Meaning Northeast Mid-Atlantic. Okay.
And they had just met to talk about workforce issues yesterday as well. So I'm gonna plan to do like a summary of these two plus the June ROHCT meeting, because I think there's been a lot of great content shared around workforce. So let me find that for you.
Thanks, Francis. Yeah. There's something here. Yeah, for sure. I'm mindful of the time, and I know we're going to move to updates here in a minute, but I want to make sure, does anybody have anything you wanted to bring up or any concerns you want to mention about your state or resources we didn't get to before we move to the next thing? Allie, I can see you talking and I can't hear you. And you're
Can you hear me
unmuted.
now?
Yes.
Okay. I have a question about the cultural competency section that you highlighted in your email.
Mhm.
So does that cover with newly arrived people, or is that, I'm not sure if that's in there.
And the answer is going to be, I don't know, because I just copied it out of notes. But I'm trying to look through and find it. Where is it? Cultural differences. Yeah, that's a really good question, and I don't know the answer. I wasn't a part of that conversation. I just kind of grabbed that from somebody else's notes. But I think it's a really good question. Yeah. Sorry. Oh, thanks, Francis, for that link. Oh, all kinds of great stuff. Okay, cool. Okay, well, if we might have maybe exhausted this conversation for the moment, but it sounds like we've got some homework to do to take a look at that spreadsheet that the Northeast group put together, see if we want to kind of do something similar. And at least I know I'm going to do some research to figure out about rural health advisory committees and figure out how do we replicate that, because that is super groovy.
And AHEX.
And AHEX, yes, those are the two things we need to research. Yes, how do we find these and plug ourselves in? Okay, I think I toss it then to Francis to do a few open updates before we get ready to wrap up. You are muted, Francis.
Sorry about that. I was taking the last note to include about AHEC. So I think for us, I see on the updates, there's future ROHCT team meetings. The ROHCT team just met in June. So now the next one is in December. I believe it's on the 5th. Open Hill Day. I hope you all have registered. That is September 12th and 13th. I should have that link for you right here. Let me just copy and paste that in case you have not registered. And so we have our next meeting for the Midwest ROHCT is August 17th, 1 to 2 p.m. Central. And I believe that is everything that we have for you all coming up. Is there any questions or anything you need from Open as far as sport or as far as anything outstanding goes? Well, I'm happy to be working with you all again. It's been a minute since I've been on ROHCT, so
it's good to have you back.
Do you have the days for are they going to do one conference with everyone, national conference? I know it'll be virtual, but do you have the dates for that?
That is October 24th through 26th.
Okay,
Not have a registration link set up yet, but we will be sending out a save the date very soon.
okay.
Oh, also the blueprint survey, if you've all seen that. I should have found that link prior and dropped that in, but if anyone needs that, please email me, or I'll send that along with the notes as well.
Okay.
Thank you.
So
Go ahead.
go ahead, Tanya.
Well, it's just since you reminded everybody about Hill Day, and if you've got the agenda too, the registration link is in the agenda as well. I wonder just out of curiosity, how's everybody doing on kind of getting a team together to do Hill Day visits? I will tell you, I'm not doing very well myself yet.
I'm not even able to attend because I have prior commitments. I'm giving a presentation out of town one day. And the other day, I can't remember what I have, so I can't do it. I can't back out of my commitments.
We can all only do what we can do. So
Yeah,
no worries. Anybody else having any luck trying to put together a team? Totally get it, Ann.
Are you going to comment, Clarence?
Not at this time. I know that I've been looking at it. I'm still in that phase of just trying to fit in and get in and see what's up. So I think we're talking, aren't we? I mean, you and I and Monisha. Yeah.
I was going to
Nancy.
say, Monisha, Clarence, and the executive director of our statewide coalition, Nancy Frank Wilson, we're getting together.
Right.
next week. So I suspect we'll have something then.
Yep.
That's a dream team right there. That's good.
Mhm.
It is. That's the Minnesota Dream Team. And just I'll say this too, in case anybody doesn't know, the reason the deadline is August 1st, which seems very early. The reason is Open is actually contracting with somebody to do the meeting scheduling so that we don't all have to contact our members' offices and try to get meetings scheduled. But they're contracting with somebody to do that work for us, which is a huge blessing and a huge, gift to all of us. And so that's why the registration deadline is kind of early, because they've got to have a sense of who all is coming to be able to start setting up meetings. So, and I think Bianca sent out a message yesterday, maybe, with some of the details about what the asks are going to be. I know at least one other state asked what the asks are going to be in order to be able to start recruiting people to help make those asks. So if that helps, check out that email from Bianca yesterday too. Cool. All right. Well, I think I toss it back to you, Kim. I'll stop talking.
Okay. Well, thank you for joining, everyone. It was a great discussion. I know I have some action points on rural health advisory in AHOC in my state. So hopefully I can find out more information. Our next meeting, our Midwest one, is August 17th, and we'll be talking to conservative policymakers. Tanya will do that. She did that, I think, last year at the conference. So bring your questions and we'll just have a round robin discussion. And I am going to give you 8 minutes back to your day. So everyone have a good day.
Take care, everybody.